All right, so we're going to jump into tooth Borne guides. So this is what we're going to be actually practicing today. Just like we talked about, just selectively extract the teeth, place the implants, plan the implants, create the guide, and then remove the bone to support that, and then remove the remaining teeth. Something I wanted to bring up too. We talked about immediate loading. It's one of the most stressful, difficult parts of full arch dentistry. It's stressful to deliver that in the procedure. At the end of the procedure, you're tired. You put implants in. Now you got to go convert this denture. And you think about sitting there, okay, my patient's chewing on my implants for 3 months. So how do we alleviate that, and how do we take that out of the beginner's hands? Obviously, there's the pull everything and give them a denture approach, right? Which lets you sleep really good at night. They're not going to jack anything up if you give them a denture. And so if your patient is open to that and you want to present that option, that's okay. It's okay to say, I want to put implants and let them sleep, come back, give them a denture. There's nothing wrong with that. It's not going to have a huge impact on your final result of your case. It's just, hey, you're just doing this in a staged approach. Let them sleep for 3 months, come back, and then put them in a temporary. You're not worried about your implants not integrating. They're integrated. Now you're just building teeth, nice and stress-free. The other option that you can think about is some of these more alternative approaches, such as temporary fixed bridges. So think about the other ideas of, you leave second molars and canines in, you place your implants, then you prep canines and second molars and you put them in a temporary resin printed bridge for 3 months, and you let them chew on that. And you've kind of got that fixed temporary teeth in a day, but you haven't loaded your implants, so you're really not stressed about your implants getting overloaded. So digital gives you these cool ways to think outside of the box, where you can do things predictably, still give the patients what they want. So I like that approach. I've got a case out there right now, just been super smooth. I did a printed resin full arch bridge, and I bonded it onto selective teeth. I literally just did dual core build-up material and sat it on, and it was all pre-printed beforehand. And then he comes back in 3 months, implants are integrated. Now you could finish that case of uncovering, removing the remaining 4 teeth, and then loading an implant-supported restoration. So there's multiple ways to do these cases. You just got to look at every case and think, what's in your comfort zone? What do you feel comfortable doing? But leaving teeth for a bridge for a while is totally a fine way to do it. And it kind of comes down to that plan A, plan B, plan C mentality too, where you think about, hey, my implants didn't get the stability I want. What is my plan B? Oh, I got 4 teeth that I was ready to go with my printed temporary bridge. I know what my B is. Or C, I've got my printed temporary denture, and I know I'm putting them in a denture, and I told the patient that might happen. So lots of ways to do it. You just gotta get creative. All right, so we'll go through some. Sorry. So you can see, this is this case. Second bicuspids and canines, sleeveless implant. You can see my 8.5, 10.5, 12.5. So I did a 10.5 offset in that case. So typically you got on that guided driver, you got 8.5, 10.5, 12.5. So you saw how I stopped right at the 10.5 because I planned a 10.5 offset in this case. But second bicuspid, canine, selected tooth extraction. We got first molar implant, first bicuspid implant, incisor, first bicuspid, first molar. And that's a perfect spread of teeth, of implants. 2 here, first bicuspid, first molar. I mean, that's a rock solid spread of implants that you're just not worried about. And all I did was I left 4 teeth in there to support the guide. And again, let's say you didn't want to load these implants, prep, like quick, dirty crown preps, bond on a resin bridge, and teeth in a day without loading your implants. So lots of different ways to do it. There's those vital root bankings again. There's multi-units. So Any questions about that? This is like an awesome way to do cases. Easy to plan, fast to do, super predictable.
This is a general question. Have you ever come across the problem when you create the guide and then you want to enter your first shortest drill and it doesn't get to the sleeve? Mm-hmm. So it's not practically guided. Mm-hmm. That happened to me. I don't know why, but I want to know.
Yeah, that's a good question. So there's a lot of reasons, like it's getting hung up on something, right? Like you're getting hung up. So if you use the Blue Sky kit, the fully guided kit, which is great, sometimes sometimes the bone is right below where your guide tube is, and your drill is hitting that bone before it's actually engaging into the guide tube. So that's where that flat drill comes in. Let me get some water, but that's where that flat drill comes in, where you can take that in and kind of bring some of the, oh, thanks, dude. And you can bring that in and take some of that bone down and, try taking that big flat drill down a little bit and then go back with your guide or your drill and go through a little bit and see if you can get it and kind of go back and forth. But I think you're hitting some bone.
I ran into that too.
Thanks, dude. Appreciate it.
With the 3.5 drill, 3.5 drill, and on the smaller drill size. But the drill itself is flared and it wasn't big enough. Because it was coming out on the bone before it was actually seating all the way down to the top of the platform on my surgical guide. Is that what you're saying?
Yeah.
Yep.
Yeah.
That's and then so flat drill or a round burr.
The time on my plan of cases on a non-immediate case. If it's an immediate, you usually have a big socket there and you're falling way down into
Exactly.
it. But if it's not, your guide tube's right on top of the gums and you go in and your drill's hitting the bone before the top part of the drill is engaged that sleeve. Right? Mm-hmm. I don't really worry too much. I just kind of eyeball that first part and punch the hole down in, and then eventually get guided, and your drill will just kind of work its way in.
So, and if it's a big fat ridge and you just know that width is an issue, you can take that 6 millimeter drill and just kind of push down, and you're going to drill. If it's thin and you're worried, which is a lot of cases, I love that round burr now to go through. And you can take
like a number 4 round?
Yeah, number 4 surgical length round burr, and kind of peck your starter hole just like you were doing a regular implant. And now your drill has something to kind of like bite into.
Are you eyeballing that through your guide, or are you taking the guide off and just doing it over the phone?
I've done it both ways because sometimes you have no visibility and you don't want to be pecking around if you're not comfortable. So take the guide off and then look at your ridge just like you were doing a regular implant and do a starter hole, then throw your guide back on, Now obviously, buccal lingual positioning could be a little off, but it's really mesiodistal position could be a little off, but it's that buccal lingual, that's the issue. That's where you're going to slip out most of the time, is slip out the buccal. And so by controlling that pilot purchase point with a round burr, that case goes really smooth.
And if it's a super thin ridge, you almost have to drill it, take the guide off, and confirm that you're still on the bone.
There's nothing wrong with that.
Because continually trusting that thing on a really thin ridge is dangerous.
Yep.
And you've only got 3, 5 ridge, and you're really squeezed something in. The guide's going to be a little bit fancy.
Yep. Yeah, those advanced ones, you can't just rely on a guide. Guide should be secondary to basic surgical understanding and knowledge. Okay, so this was that case. So this is this case. So you can see, there's where the positioning of the implants are. And you can appreciate guided surgery, just how sexy it is to look at your pano and pat yourself on the back and say, all my implants are really, really straight, really nice. That one maybe could have been a little deeper, but whatever. And now we're restoring this case. So this is the Onyx resin, SprintRay's new Onyx resin, which you guys are going to get to play today. So play with today. We've been using a demo from SprintRay for a while, And then Monday is the release of the actual Onyx resin. They literally just announced it to the public yesterday. And then Monday it's available in their store. So I anticipate it selling out like day one. That's just my guess. But we're going to go on and buy some. So think Monday, if you guys are interested in doing this stuff. I don't know what the cost is, but it's going to be expensive because this resin, this crown and bridge resin stuff is just getting more expensive, and it's getting better, so it's getting, they're raising the price. So Sprint Raise Onyx resin, this is a digital workflow, but you can see printing out this temporary, like look how passive this thing is. Like I'm just literally setting it on, and it's just dropping right down onto the multi-units on my master cast. So just really cool workflows with all this stuff. The new resins, the printing is awesome. You guys are going to get to demo it today.